Hidradenitis Suppurativa, or HS, is a chronic skin condition. It causes small painful lumps under the skin. These lumps can break open and cause tunnels under the skin. This condition often affects areas where skin rubs together. Common spots include the armpits, groin, and under the breasts. HS is not just a skin problem, it is linked to inflammation in the body. Many people with HS have other health issues like arthritis or metabolic syndrome. It is not contagious, so you cannot catch it from someone else. But it can be very painful and affect your daily life. Many people with HS feel embarrassed or ashamed. They may try to hide their symptoms, but it is important to talk to a doctor. Early treatment can help manage the condition. Understanding HS can help you take control of your health. The symptoms of HS can vary. Early signs include small, painful bumps. These bumps can grow and turn into abscesses. Abscesses are deep, inflamed sores filled with pus. They can burst and leak fluid. This can be very painful and lead to scarring. As HS progresses, tunnels may form under the skin. These tunnels connect the abscesses. They are called sinus tracts. Sinus tracts can cause more pain and infection. They can also make the skin look bumpy and uneven. Other symptoms include blackheads and red, swollen areas. The skin can become thick and scarred over time. Some people also experience flu-like symptoms. This can include fever, fatigue, and general malaise. It is important to seek medical advice if you notice these symptoms. Early diagnosis is key. It can help prevent severe symptoms. A healthcare provider can offer treatments to manage the condition. Keeping track of your symptoms can also help your doctor understand your condition better. The exact cause of HS is unknown, but several factors may contribute. Genetics play a role. If you have a family member with HS, you are more likely to develop it. Hormones may also be involved. HS often starts after puberty and can worsen with menstrual cycles. Obesity and smoking are risk factors. They can make HS worse. Excess weight causes more skin friction. This can trigger HS flare-ups. Smoking affects the immune system and skin health. Quitting smoking and losing weight can help manage HS. Some researchers believe that blocked hair follicles cause HS. This blockage leads to inflammation and infection. The body's immune response can also play a role. It may overreact and cause more inflammation. Understanding these causes can help in finding effective treatments. Environment and lifestyle can also impact HS. Wearing tight clothing can irritate the skin. Stress can trigger flare-ups. By managing these factors, people with HS can reduce symptoms. It is important to identify what triggers your HS and avoid them if possible. Medical treatment for HS aims to reduce symptoms and prevent complications. Antibiotics are often the first line of treatment. They help reduce infection and inflammation. Both oral and topical antibiotics can be used. They are most effective in the early stages of HS. For more severe cases, doctors may prescribe biologics. These are medications that target specific parts of the immune system. They help reduce inflammation. Biologics can be very effective, but may have side effects. It is important to discuss these with your doctor. Surgery is another option for severe HS. It can remove large areas of affected skin. This can help reduce symptoms and prevent new lesions. Laser therapy is also being explored as a treatment. It can remove hair and reduce inflammation. Pain management is an important part of treatment. Over-the-counter pain relievers can help. In severe cases, stronger medications may be needed. Working with a pain specialist can help find the right treatment plan for you. Alright, let's dive into Section 5. Lifestyle changes. Lifestyle changes can really make a big difference when it comes to managing hidradenitis suppurativa. Maintaining a healthy weight, for example, is absolutely key. It can help reduce skin friction and inflammation, which is super important. And a balanced diet with anti-inflammatory foods can be a game changer too. Make sure to include plenty of fruits, vegetables, and whole grains in your diet. It's best to avoid processed foods and sugar as much as possible. Good hygiene, of course, is important as well. Keep those affected areas clean and dry. Using gentle, non-irritating soaps can really help. And avoiding tight clothing that rubs against your skin is a good idea. Instead, go for loose, breathable fabrics like cotton. This can really help prevent those pesky flare-ups. Now, quitting smoking is crucial. Smoking makes hidradenitis suppurativa worse and affects healing. But don't worry, there are many resources out there to help you quit. You can talk to your doctor about options like nicotine replacement therapy or counseling. Stress management is also super important. Stress can trigger HS flare-ups, so practicing relaxation techniques like deep breathing, meditation, or yoga can be really beneficial. And hey, regular exercise can also help reduce stress and improve your overall health. Finding what works for you can make managing hidradenitis suppurativa a whole lot easier. Section 6. Real-life patient stories. Sarah was diagnosed with HS at age 25. She struggled with painful abscesses for years. It affected her confidence and social life. She felt isolated and embarrassed. Sarah decided to see a dermatologist. She started on antibiotics and made lifestyle changes. She lost weight and quit smoking. These steps helped reduce her symptoms. John has had HS since his teens. He experienced severe flare-ups that required surgery. John found support in online communities. He connected with others who understood his struggles. This support helped him cope. He learned tips and tricks for managing his condition. Rachel's HS was mild but persistent. She managed it with good hygiene and stress management. Regular yoga and a healthy diet helped her keep symptoms at bay. Rachel also found it helpful to keep a symptom diary. This allowed her to identify triggers and avoid them. These stories show that HS affects each person differently, but with the right treatment and support, it is possible to manage the condition. Sharing experiences can provide valuable insights and encouragement. Section 7. Impact on daily life. HS can have a big impact on daily life. The pain and discomfort can make it hard to do everyday activities. Simple tasks like walking or sitting can become painful. This can affect work, social life, and overall quality of life. Many people with HS feel self-conscious about their appearance. They may avoid social situations or intimate relationships. This can lead to feelings of isolation and depression. It is important to talk about these feelings with a trusted friend or therapist. Living with a chronic condition requires planning. People with HS may need to adjust their routines. They may spend extra time on hygiene or changing dressings. This can be exhausting and time-consuming. Finding a routine that works for you is important. Despite the challenges, many people with HS lead full, active lives. Finding the right balance and support can make a big difference. It is important to focus on what you can do rather than what you cannot. Small adjustments can lead to big improvements in quality of life. Section 8. Emotional and mental health. Living with HS can take a toll on emotional and mental health. The chronic pain and visible symptoms can lead to feelings of anxiety and depression. It is important to address these feelings and seek help when needed. Mental health is just as important as physical health. Support groups can be very helpful. Connecting with others who understand your experiences can provide comfort and encouragement. Online communities and local support groups are great resources. They can offer practical advice and emotional support. Counseling or therapy can also be beneficial. A therapist can help you develop coping strategies. They can provide a space to talk about your feelings and challenges. This can help reduce stress and improve overall well-being. Self-care is crucial. Take time for activities that make you happy and relaxed. This could be reading, gardening, or spending time with loved ones. Mindfulness and relaxation techniques can also help manage stress. Prioritizing mental health can improve your ability to manage HS. Section 9. Conclusion, hope, and management. Hidradenitis Suppurativa is a challenging condition, but with the right treatment and lifestyle changes, it is manageable. Early diagnosis and treatment can make a big difference. Working with a healthcare provider is important. They can help you find the best treatment plan. Remember, you are not alone. Many people live with HS and lead fulfilling lives. Support is available. Whether through medical treatment, lifestyle changes, or emotional support, there are many ways to manage HS. Stay positive and proactive. Find what works for you and stick with it. Managing HS is a journey, but it is possible. With the right approach, you can take control of your health and improve your quality of life. There is always hope for a better tomorrow.